Support comes from Hampton Roads Community Foundation, carrying out your charitable wishes forever, whether it's helping shelter animals, feeding the homeless, enhancing the arts, or supporting students. Learn more at leaveabequest.org.
Hello, everyone. I'm Barbara Ham-Lee. So, you've got chills, a fever, runny nose, body aches. Is it a cold, the flu, RSV, COVID? How can you tell the difference? And what should you do to treat each one? Up next on Another View on Health, cardiologist Dr. Keith Newby, he's on call with expert advice on how to handle each one of these respiratory diseases. And while you're being encouraged to get both your COVID booster and the flu shot at the same time, is this the best advice? The answer may surprise you. Another View on Health is coming up next, right after this national, regional, and local news from NPR and WHRO News.
Discussing today's topics from an African-American perspective, this is Another View.
Good afternoon, everyone, and welcome to Another View. I'm Barbara Ham-Lee. 'Tis the season to stock up on fever reducers, cough medicine, pain reducers, and hot tea because cold, flu, RSV, and COVID season is here. So what's the difference between the four, and how can you tell which one you have? Our favorite cardiologist and co-host of Another View on Health, Dr. Keith Newby, is here with some much-needed advice. How are you, Dr. Newby?
I'm doing well. How are you?
I'm doing just fine. So before we start talking about COVID and flu and colds and RSV and all of that, I want to know how you're doing with your master's program in public health, and what are you learning that is completely different from what you've been doing all these years in terms of cardiology?
Well, I appreciate you asking that. I'm actually doing well. I am passing, which is great.
Excellent.
And my scores are actually high, so everybody jokes on me and calls me an overachiever. But I can't help myself. That's in my DNA, I guess. But interesting. I tell you what I'm learning, and I think this is something that we may want to talk about in the future. Is even though I've always been just straight, medicine, I learned about different disease processes, how to prevent, how to treat. But one of the things I have learned over the last year, which is actually, when you think about it, is a lot. It makes more sense when you think of it this way. They say that 80% of chronic medical conditions, and that's what I'm all about, is heart disease, hypertension, diabetes, arthritis, obesity, things that we see all the time, but they are majorly influenced by social determinants of health. So you talk about things like housing insecurity, food insecurity, financial insecurity, things that impact a person's ability to live their best life influences health tremendously. So that's something that it makes sense when you really think about it, but in our medical world, we don't look at things that way, but when you think of it in the public health sphere, it makes total sense. Because if your house is insecure, what's the likelihood that you have money to pay for a doctor's visit?
Good point.
Which means what's the likelihood you'll be able to buy the types of foods that are most healthy for you? It will be diminished, which means your potential for the other medical conditions go up tremendously. So it's kind of interesting how that influences and how that impacts.
So is it a huge learning curve? I mean, in terms of, because I know it's different. I guess I think of doctors as kind of getting a baseline and then specializing. And so this is totally different from what your specialization was. So is it a big learning curve for you?
And no, actually not. The only thing is, I'm an old dude. I haven't written a paper in 30 years. So I gotta write papers now. I mean, that is like way off of what I'm used to doing. I mean, we always have continuing medical education and medical worlds. I go to courses all the time on cardiology things because you need to keep up. You need to know what's going on.
Sure.
We have to recertify in our boards every 10 years. But I don't write papers. So when you talk about the background research, that is fun, though, to be honest with you, because I love learning new things. So for me, although I joke about this with you here, but to be honest with you, it wasn't a big learning curve other than getting back into a college mode of, writing things and doing the background research. But it expands your horizons, and it has you thinking down paths you never thought before, which is why I like it. So it's just, I'm going to see where this takes me in terms of career paths and things that I may want to do.
That was going to be my next question to you. So is this going to be an enhancement of your cardiology work, or do you think you might go in a whole different direction at some point?
Let me say, I think I got patients who would kill me right now if I told them I'd go in a whole different direction. I not right now. I think what I want to do. I got my hands in everything. You know how I am. Yeah. So what I look at as an enhancement, but it helps me with my health equity work with Centera. So when I look at interventions, how do we impact communities? And that's really where my focus is now. Well, I mean, it's still in my cardiology world, of course, but what I want to be able to do is say I'm impacting communities. I'm helping communities live better, and if I can do that, that's the kind of legacy I want to leave behind, is that which I've done that helps people.
Fantastic.
And that is it's altruistic, but what can I say?
What can you say?
I love what I do.
That's great. Okay, so the news has been touting a triple-demic, meaning flu, RSV, and COVID, but I call it a quadruple-demic because of the common cold, too, because that's also coming back around. So why are we being hit so hard this year?
Well, I think, COVID sure didn't help anything, and to be honest with you, I think a lot of it is this stuff's been around anyway. This is nothing new other than COVID over the last few years, but that's why we always recommend flu vaccines, because flu, although it wasn't killing people like COVID was, but people who have these, we talked about these chronic medical conditions that, people who say cancer patients or chemotherapy, or people that may have, for other reasons, lower immune systems or reduced immune system response, you're going to be at higher risk to develop or to catch one of these other illnesses. And a lot of them overlap because they're mostly respiratory viruses. Right. So there's a lot of overlap here.
Well, actually,
you cannot assume that.
In the New York Times, there was an article that says during flu seasons from 2009 to 2022, rates of hospitalization were 80% higher among Black adults, 30% higher among American Indian and Native and Alaska Native adults, and 20% higher among Hispanic adults compared with white adults. So it's, people think, it's just the flu, but the flu can be very serious.
Yeah, it can be. Again, it goes back to your other medical conditions and your lifestyle. It goes back to that social determinants of health I was mentioning earlier. If you're in, say, like if you're in your household, you have multiple people in your house. Of course, that's going to quadruple the risk you're going to catch something. You got, how little kids always coming home from school with the stuffy nose syndrome, and because they catch stuff from these other kids, and then they bring it back into the house. So I tell you the one thing I think what COVID did for a lot of people that it didn't do before. People were trifling about washing their hands. And you know what I'm talking about.
Yep.
I wish they had a buzzer on bathrooms when people came out without washing their hands.
Get back in there and wash your hands.
Hey, I'm gonna tell you. Unfortunately, so that I think that was one of the only positive things that it had people more cognizant of. When they cough. At least if not coughing in your arm, not all on your hands, but but you think about what that did, it brought to light things that we kept ignoring before. And, and for a while, though, I think when the pandemic first hit, if you remember, the flu rate was markedly lower.
Right.
That particular year that COVID really hit and everybody was on lockdown, flu rates went down tremendously that year.
Because we weren't interacting with each other, right?
Exactly. So that means that, now I'm not saying that should be our norm,
right,
but I'm just saying, but it goes to show this is it's transmitted through close personal contact.
Mm-hmm.
So that's why I keep trying to get people to say, don't let your guard down. And people want to go back to where they were. And I'm not saying that we should be on lockdown, but don't start getting complacent.
So should we still be wearing masks, for example?
I am. Mm-hmm. I am. I mean, because I'm not trying to, listen, I have been blessed. I have not caught COVID. I'm around COVID all the time.
Yeah.
Everybody around me has caught COVID, but I have not gotten it, and I'm diligent with this stuff. Now, again, there's a balance. There is a balance between, your mask wearing and what have you. And some people feel comfortable, going around folks without masks. And I don't knock them if they're fully vaccinated.
Right.
But a lot of people still aren't. And I'm like, well, I had COVID 2 years ago. I said, that's got nothing to do with the price of tea in China. I said, if you're vaccinated, I said, that was 2 years ago. What about now? Mm-hmm. I said, we got, this BA.5 variant, which is the main predominant variant that's affecting everybody. It has ducked and dodged the vaccine previously. That's why they came up with a new booster, to try to help make sure that we protect ourselves from that which is here. Because, again, death rates are much lower, but the complication rates of COVID are still pretty high. Yeah. The long hauler syndrome, people are having long-term effects from this stuff.
Mm-hmm. So you wake up, you got a stuffy nose, or your nose is running and you're coughing, you've got some body aches. Should you automatically assume it's COVID, or should you automatically assume it's a cold? What do you do when you start to feel bad?
At this stage, you have so many rapid tests out here that are available. I say test yourself, especially if you're not vaccinated. I mean, if you're vaccinated, it's a judgment call. Mm-hmm. I just assume go ahead, test yourself, and make sure. Because think about it, you get ready to go out into the world and unleash all what you have onto everybody else is out here. Why not have a couple of home tests available? Mm-hmm. And you can test yourself to make sure, because it's hard to differentiate because there's so much overlap on symptoms. This is like you talk about like RSV versus colds versus flu versus COVID, because there are different degrees of infection. So you may have somebody with sniffles and scratchy throat, and you could have all four. I mean, you really think about it. It's all about degrees, and it's hard for you to be able to tell. The only way you can tell is you got to get tested.
Right.
So, they do have tests for RSV, have tests for flu, have tests for COVID. Common cold stuff, they may have a test for that. I'm not familiar with that one, but I know they do have tests for all the other ones. It's nasal swab. Mm-hmm. So you can test yourself for other infections, but to me, COVID is one of the main ones you want to make sure. But, you don't want to give a flu to anybody either.
Exactly. That's the other thing, too.
Yeah. You don't want to give that to people because, again, that's the only thing I get so concerned with in our world today. We're so cavalier with things, and we've gotten so selfish. That breaks my heart, because as a physician and as somebody that cares about the community, the things I do, I try my best to take other considerations at heart. Mm-hmm. Am I about to do something that's going to affect somebody else's life? Now we've gotten so I ain't worried about them. I'm just worried about me. And I really hate to see that. Now that's not everybody, of course, but I'm just saying I just really want us away from that cavalier idea that because we're ill, we could just go out and just, not worry about how what we do affects other people.
And plus, since in a lot of our households, in particular, we live in multi-generational households, and so even if you as a younger person may be healthy, but you also have to think about those older folks that live in your household also. 757
and their medical conditions.
Yeah, and their medical conditions. 757-440-2665 or 1-800-940-2240 are the numbers to call to join our conversation. What questions do you have about either the cold, the flu, COVID, or RSV, which we know affects children, but adults can get RSV too. Is that correct?
Yeah, I mean, everybody has potential. I mean, and that's the thing. So you don't want to. It's more in the younger people, no question about that. But you can, as an adult, get affected with RSV as well. And just so people hear those symptoms or they see their child that, usually it's going to kind of pop up about somewhere between 4 and 6 days after getting exposed. And the runny nose, decreased appetite, coughing, sneezing, fever. Some people will get short of breath or start to wheeze. Some may not. But again, it's just those are standard viral symptoms. And, and again, if I read out to you COVID symptoms, they're going to be similar. Because remember, at one point in time, we could say loss of taste and smell with COVID. That was one of the differentials. That's not the case as much anymore. So you could have COVID and have full taste and smell. So because, again, remember, and I tell everybody, viruses like to mutate. And when they mutate, they change what they do. So those are the things that people have to always remember. You cannot rely on any one thing that really can help you understand, this type of thing. You just have to take all things into consideration. If you have any chronic medical condition that may reduce your immune response or put your risk put yourself at higher risk. If you're diabetic with a blood sugar of 400, you may feel fine, but that doesn't mean you are fine, and that's puts you at higher risk. And as an older person, you could get RSV as well.
Okay. We have a question from Facebook. This gentleman, Kevin, wants to know, when should you get your flu shot? He says he got a shot in September one year and then got the flu the following May. And so he's wondering if he got it too soon. How long does the flu shot last?
Well, it depends. It depends on which flu is out there. Most vaccines, you have this peak effect. Usually the first probably 2 to 6 weeks after you get a shot, that's when your immune system starts to peak. It really just depends on which flu variant you have, because typically what they do is through their testing, they say, okay, this is going to be a predominant strain of the flu this year, so they develop the flu shot to combat that. But whether or not you come about the next May, is it the same flu strain or is it a different one by that time, you don't know. So this is the thing that I want to make sure that we do emphasize. And, one of the biggest pushbacks I got from COVID vaccines were people saying, well, I took the vaccine, I still had got COVID. And I tell people, I said, listen, vaccines are designed to prevent. I said, I can try to prevent a heart attack, don't mean I won't ever have one.
Right.
But that means my risk is a lot lower if I'm exercising every day, if I'm, doing all the things I'm supposed to do, make sure my cholesterol is fine, blood pressures are good. If I'm diabetic and my A1C is less than 7, I'm going to have a markedly reduced incidence of heart attack, but it doesn't mean I'm never going to have one. There's nothing in life that's 100%. But what we want to do is reduce your risk to, substantially if we can. Hence, the flu vaccine, COVID vaccines, they will reduce your risk.
And
it
also,
doesn't make it no risk, just reduce risk.
And also, doesn't it also help to keep you from getting as sick if you get it?
Yes. Because think about it like you're building an army. Your antibodies are like your army. So, if you have, say you get, I'm just going to throw an example. I get a lot of people that will fuss at me about COVID vaccine, they'll say, well, I exercise every day, I'm eating right, I take all this stuff. And I'm like, great, that's wonderful. But your body has never seen COVID, or it hasn't seen COVID in a while. Your immune system, you can't train it to fight something it's never seen before. If the way antibodies work is antibodies are formed to fight certain infections based on memory. So so the vaccines, usually what you do is you're creating a scenario so that your body sees something and it remembers it, so it knows what it has to do to fight it. So you could exercise all you want to, and it's better for you to do that, because what it'll do is it'll make you more responsive quicker. But if your body's never seen COVID-19, if it's never seen the flu, it's not going to be able to, just because you exercise every day, that's not going to help prevent the infection if you haven't been exposed to something that allows your body to remember what it needs to do to fight it. It has to be able to attack that particular virus. So that's the thing I'm trying to make sure people see. So if you build that army with a vaccine, that army has built up, but it doesn't mean that you can't still get infection. But you think about it. If you have an army of 1,000 fighting another army of 1,000, you have much better odds at winning that battle than if you have one person trying to fight an army of 1,000.
Yeah, absolutely. So should you get your flu shot and your COVID shot at the same time?
Well, I would put it like this. Personally, I'm not a big fan of that.
Okay.
I'm not saying that you can't. And the CDC is recommending that you do both at the same time. And what their recommendations are just so you get it done.
Right.
And, because some people are unfortunate, so they're ducking and dodging stuff like they're the IRS or something. But the thing is, if you think about it like this, I personally, I took my last booster about a month and a half ago. I took my flu shot 2 weeks ago. So, spreading it out can be advantageous only if you're going to have a reaction. Because some people, they will react when you get a vaccine. The question is, you get them both at the same time, which one did you react to? You don't know. And unfortunately, so some people say, well, I'm not doing that again.
Right, and then they won't get either one.
So they won't take anything.
Yeah.
So that's the only thing. So if you're the kind of person that you say, well, listen, I just want to get it done, then I say go ahead and do it. You get both of them at the same time. If you're like me, I'm a little bit more cautious. I'd rather split mine up, which I did.
Well, I went to the doctor this week, and they also encouraged me to just get one, which I got my flu shot, and then I'm going to be getting my booster coming up in 2 weeks, right?
Okay. Yeah. And we're doing them at our church in 2 weeks, and that's where we're going to be seeing you there. That's First Baptist Butte Street in Norfolk. Satara's helped me out with that clinic, and we're going to do that with my practice, a Newby Foundation, and Centera putting that together, and hopefully we'll see some other people out there.
And that's going to be on November the 5th?
November 5th.
At what time?
8 and 12. 8 a.m. to 12 noon.
At Butte Street, the historic
First Baptist Butte Street.
First Baptist Butte Street, absolutely, in Norfolk. 440-2665 or 1-800-940-2240. Keith, we got another question on Facebook. Elizabeth wants to know, what daily precautions can you take to help ward off viruses? Do things like emergency or vitamin D supplements help?
I think to some degree, yes. But I tell you what I tell people all the time. You can vitamin yourself up, and that's fine. Whether or not it's actually going to help remains to be seen. I tell people, eat a balanced diet. Make sure if you eat that balanced diet, you get your fruits, your vegetables. Most vitamins are going to be in the foods you eat. Supplements were designed if you weren't, say like people that are dieting, they're fasting, or they're doing other things where their diet may be shy of certain things. So they say they're vegetarians. So, like the iron, this, you'll find in red meat. You're not getting that anymore. So vitamins are really designed to supplement that which you weren't getting in your daily eating habits. I mean, if you know you're a lousy eater, then it would be a bad idea to take these supplements because you get what you need on a day-to-day basis. But eating a balanced diet, getting your exercise, American Heart says we're supposed to be doing 30 minutes 5 days a week of some light to moderate activity, which could just be simple walking. So I encourage people to get out and walk. I mean, you'd be surprised what that can do for your day-to-day health. Those things, when I mentioned earlier about people saying, well, I don't need vaccines, I do all this exercise and I supplements, do all this other stuff. And again, it's great. That will help, but it's not going to cover you completely. I like to see a comprehensive plan. So I would tell that individual, yes and no. The best thing is just to eat properly, exercise, and that would do you better than any supplements you could take. But if you know you're going to be shy of those things and you're not going to do everything you're supposed to have, then I would encourage that, because I think overall it will help.
If you're just joining us, we're talking about COVID, flu, RSV, and the cold with cardiologist and co-host of Another View on Health, Dr. Keith Newby. Give us a call. Let us know what your questions are. 757-440-2665 or 1-800-940-2240. So, Keith, a lot of, especially for the cold and flu, and even COVID, after you've been diagnosed with it, you pretty much stay home and take care and treat the symptoms. But when should you go to the hospital? When do you need to know that you need to really go see someone?
I tell people all the time that if you are, say like an example, your breathing is affected adversely. And when I say adversely, people that shortness of breath, a lot of people think that shortness of breath means you have to be in dire straits. Shortness of breath is simply an awareness of your breathing. Now, if you think about it, when you breathe, you don't think about it. You're not really aware of it. You just breathe.
Right.
And that's just a common part of our life and what we do. But when you're aware of it, that means something's not right. If you can tell you're like, okay, I'm feeling this, I'm breathing here, and it's not, I normally don't tell, I can't tell I'm breathing, I'm just doing it. But when you can tell, that means something is going on. Now, if it escalates to a point that you feel uncomfortable, it's better to go and be checked out than to necessarily wait. I know how it is. I ain't trying to sit up in this emergency room for 20 hours. I mean, I get it. Trust me, I get it, because I work in the hospital every day. So sometimes I go in the emergency room, it's like standing room only. And that part I do understand. But if you are a person that where you normally are in your life in terms of how you feel, and we've all had the cold, common cold, and I may cough, and I may sneeze, I may even wheeze to some degree, but I'm like, okay, but I know I don't feel bad per se other than viral symptoms. But if you can see that things are trending in a negative direction and you're starting to become more aware of your breathing and it's becoming more short, that's time to me to go to the hospital and be checked out, because you don't want to wait until it's gotten to a point of no return before you go.
So my daughter got COVID from, she's a school teacher, and one of her kids tested positive, and a few days later she did, and that was back in September. And 20 days later, another child tested positive, and she got COVID again.
Yeah.
And so, So the question she asked me to ask you is, when should she get her newest booster? Because some people are telling her she needs to wait 4 to 6 months. I told her I didn't know, so I was going to ask you.
Yeah, the recommendations are 3 months after your
3 months.
3 months after your COVID infection. Now the question becomes is whether or not between one question, what was the time duration between the first infection and the second?
20 days.
Okay, because this is the thing. There's a possibility that it may have been the same infection. She just thought it was a new one, because some people do relapse.
And she tested, and she tested negative in between.
What, on She did in between?
Mm-hmm.
Okay, all right.
Mm-hmm.
I have seen people do that too, and it's still the same infection.
Okay.
Where they'll test negative and test positive again. That has been reported in the literature. So it still could have been that same infection. She just had a relapse in symptoms. So that can happen. It's a little odd to get two infections that close together.
Mm-hmm.
It's not to say it's impossible. It's just odd. Now, she had two different strains she got. Say that maybe the first strain could have been listen, there's so many strains out there. I think it was the primary. The first one is still out there. It hasn't just totally dissipated out. Mm-hmm. But I know the Omicron was the one, and the BA.5 variant is part of that Omicron variant. So the BA.5 is the predominant strain right now. That's out here, and that's why I encourage people to get the most recent vaccine, because the prior vaccines are not suitable to fully protect you from the BA.5 or the BA.4. This most recent booster is there designed to get the BA.5 and the BA.4 variant. So I would definitely encourage people to get it for that reason. Okay. So to go back to your daughter's situation, again, I'm not 100% convinced that it wasn't still just that first infection, just relapsed. If it was two separate ones, she could have got two separate strains that she caught. One kid had one, the other kid had a different one. Mm-hmm. But the recommendations are 3 months.
3 months after?
Yeah, after infection.
Okay.
Now, you can get it 2 months after your last booster if your last booster was the original vaccine and you're trying to get the new one. It's 2 months after your last booster, or 3 months after your last COVID infection. But I want to make sure people understand, too, that you have to have your first series first before you get the booster. So if you've never been vaccinated, you're not going to get the new booster because that went through the FDA as a booster. So you have to get your first series, then after 2 months.
So
you have to get your first.
There are still people out there who have not gotten their first.
Oh, heck yeah! Heck yeah!
Wow.
I got several patients who never been vaccinated. It drives me nuts because and they never have a solid reason why. And again, I'll be honest with you. I know a lot of people would call different things into play. They'll have religious doctrine. I have personally never seen any religious doctrines that don't take a vaccine. I've never seen that. Now, some people can interpret a doctrine to say that, but I've never actually seen that personally, where, when I'm looking up, because I like to look things up, and I've never seen a religious doctrine say you can't take a vaccine. I think people interpret it that way. Mm-hmm. But I look at it as if you're going to take a pill for hypertension, I don't understand. I don't get it. What's the difference, really? Because all one is doing is treating an infection or treating a condition. Other one's trying to prevent an infection. It's still medication that's designed to serve a purpose.
So if with all these different variants that keep coming up and they keep making new vaccines to fight specific variants and so forth, do you foresee a time where these vaccines will become like routine, that we will have to do this all the time? Like the flu shot, because the flu one changes each year also,
I know.
Right?
It kind of, it's hard to say. That's predicting the future. I know a lot of people say they think it's going to be like a yearly thing, and it very well could be. But that's futuristic. We don't really know. It just depends. Because, they got rid of smallpox for a while. No comment on that one. But anyway, I don't want to sound conspiracy theorist, so I'm not going to give it about ammunition. But anyway, moving right along. I honestly, my gut impression is yes, we're probably going to need to do this for a while. But whether or not this is going to be just routine for ever and a day, amen. At that part, I don't know. I would say this: I do believe if we put politics aside and just got what we're supposed to get, I think, from the start, I think we would have been better off than where we are now, personally. And I say that because unfortunately, because you have so many people that didn't get vaccinated, and a lot of people say it doesn't matter. Well, it does matter. And I'll tell you why it matters, because I lived in COVID for the last couple of years. That was the only infection that I would have to say made me nervous as a provider, because I was seeing people dying in front of me with COVID-19 that I didn't see with other conditions. Other conditions like HIV, when that came out, now, of course, I won't tell my age, but, when I was an intern and resident at Emory in Atlanta, that was, HIV was rampant then. It was like, but we knew how you could catch. There wasn't like a respiratory illness. Right. You couldn't get it touching somebody. It had to be sexual contact or some type of transmission of fluids to get HIV. So it was different then. This stuff, you could just be in the wrong room at the wrong time and catch COVID. So we were seeing people dying a lot. After the vaccine started getting distributed, I guarantee you 2 months later, I saw this dramatic drop in hospitalizations, dramatic drop in people who were dying of COVID-19. And I know it was vaccination-driven. So, that's why I keep pushing that I know I hear people, I hear the concerns, it came out too fast. I hear that one more time on the screen. I'm like, who says the time frame that it has to take to do a vaccine? I never heard that before. We don't know for sure. There's no rule book that says there's a certain time. We couldn't wait forever to do this. So they did the basic testing. They made sure it was safe and effective. Then it came out with it. Normally there's a ton of red tape that, prevents these things from coming out. So, and everybody now has full FDA approval. So now we can't say that it's too soon, because it's gone through the process and it's been fully FDA approved. So now we can't use that anymore. So that's what I'm trying to make sure we do. We want to take the necessary precautions because of both the potential for death and hospitalization, but equally as important, long-term symptoms and how it may affect somebody that you love. And you don't want to do that. You know how you would feel if you gave your mom COVID-19 and she died from that?
Yeah.
And it was on you because you were the one that took the approach you did and didn't want to protect yourself and do those. I don't want to live with that fear. Exactly. I don't want to kill my wife or my kids, because of
being hard-headed.
My choices. Yeah.
So there was a situation at Stafford High School in Fredericksburg where 1,000 kids were infected with the flu, with flu-like symptoms, and they traced it back to a homecoming dance, and they had to shut the high school down. Is this something? Is this kind of indicative of what we might be facing this winter coming up?
It's potential. I haven't seen it quite to that level of that type of transmission, but I think the cavalier nature we've gotten to, because unfortunately, so once this mask mandate went away, everybody went hog crazy, and they were just taking the mask off, wasn't doing anything, and that's the thing. And the question becomes is whether or not a lot of those kids, were they ever infected with COVID-19 in the past, and was it affecting their immune system where they just were,
where the flu just took over from there?
We really don't know, but I tell you, you think about it, historically, how often have you seen that happen? Wow. And that's not a commonplace problem where you see where they have to shut a school down because of the flu from a homecoming dance. So that's telling me that there's something different now that wasn't then. And that's what I try my best to try to think about things from a logical perspective and from a health perspective, just knowing what I know being in medicine. So, you got to ask yourself, what is it that's different that did this? Now, it could be just the particular strain that was predominant, that was just extremely contagious, and that could be the case as well.
Well, and the flu virus also lasts on surfaces and through coughing and all of that too. There are many different ways to get it, isn't it?
Yeah. I mean, and it can because it is, you're coughing on stuff and you're touching stuff, especially you cough in your hands and you touch a doorknob. I mean, things, surfaces that, and you think about, but I'm thinking about in a homecoming dance, of course, we talk about enclosed place.
Yep.
I'm assuming it was inside.
Mm-hmm.
But you think about it, most dances are going to be about a couple of hours.
Right.
So
Right.
for you to get that many people affected that short period of time, it probably was respiratory, in this enclosed space. So then you have to ask yourself, well, why now? Why was this the case? Why is it predominant? So again, it's either going to be the strain that was predominant, or some people may have just a reduced immune system, whatever the case may be, and it just went rampant from there. But to close a whole school down because of that says a lot.
Yeah. So I know you're a medical doctor, but I want to ask you, what are the best home remedies for the flu or the cold, or or if you're feeling bad? What should you do?
Yeah, it's kind of interesting. My mom is, you hear this adage, feed a cold, starve a fever.
Yes.
I mean, I've had the flu before. It's been years since I've had the flu because my wife always makes me get vaccinated every year. She tracks me down in the office. I'm gonna tell you, I never seen anything like it before. She'll follow me everywhere until I sit down and take it. So she gets me on a regular. But I appreciate that because she's trying, because we as providers, we could get so in ourselves trying to help somebody else, we forget about taking care of ourselves in the process. But I would say this. To me, I'm always one. You want to stay hydrated. That's first and foremost. Okay. You want to stay hydrated because dehydration is probably one of the worst things you could run into because that starts to shut things down as opposed to, you think about kidney flow, your just your general well-being. So you want to make sure you stay hydrated. That's probably the most important thing I could ever tell anybody to do. If you're really treating the symptoms. There are antiviral drugs out there. And there's no vaccine for RSV, but there are antiviral medications to shorten the course. So those are options for people.
So they actually do shorten how long you have it? Okay.
Yes. Now, again, each person is an individual. But, when they came out with Paxlovid for COVID, that was it was designed to shorten the course and to decrease the amount of symptoms you were having. And it does work. So there is one for RSV as well. I can't remember the name of it, but I think it begins with a P as well. So you can request that, if you were infected with that. So you would have to get swabbed and all that. But to answer your original question, I think symptomatic treatment is always key. Make sure you want to keep hydrated, and you also want to keep your as best you can your food intake up enough so that you're still getting the vitamins and the nutrients that you need, because it will potentially cause more problems if you don't do that. It may drag out how long you have it, but it's more symptomatic treatment. Tylenol, Motrin if you need it. Anything, nasal sprays, stuff that symptomatic treatment for it. And make sure you watch yourself and you're protecting yourself from the other people that you could potentially infect, because you don't want to spread it around.
And just basically you need to rest.
Yes.
Because I know a lot of people say, I got to go to work. It's just a cold. I got to go to work. But if you really feel bad, you should stay home, shouldn't you?
Listen, I'm one of those people, too. Yes, I would agree with that. I tell you, it's kind of a this is where you have to use some judgment. I mean, if you have COVID, you need to definitely stay home.
Yeah.
If you have the flu, you need to definitely stay home. If you have RSV, you definitely need to stay home because you don't want to spread that around. Common colds, it just depends. I'll be honest with you. People joke on me at work, and I'll ask you this question, Barbara. You probably know me well enough to know what I'm going to say, but you just won't know the year. You know the last time I missed a day of work?
Oh, probably never.
Well, no, I have.
Well,
I have.
You missed a day of work when you got married or when one of your children were born.
Oh, before that. The last day I missed a day of work was 1991.
Wow.
I was a resident at the VA hospital in Atlanta because I was at Emory, so they rotate us through different hospitals. And I had somehow I got some kind of sinus infection. I don't know what it was. I had a fever of 104. And that was the worst feeling I ever had in my life. And I'm going to tell you, I tried to call because I was on call that day that it developed. Do you know how much I got berated for calling out? I'd never missed a day of work after that.
Oh, my goodness.
I'm going to tell you, they made me feel so small, like I was shirking my responsibilities. I have missed a day of work since then. 1991, last day of work. Now, that's a blessing because some people, they have medical problems that they can't help.
That's true.
Now, I'm not talking about that, but I'm talking about if I have my toe sprained, I'm not going to miss a day of work for that. If I have a cold, if I'm like going to be, some ridiculous fever or something. I mean, I've been I'm nauseous, throwing up in the bathroom, but I'm still at work. It just depends on what the underlying is. I'm not going to expose anybody to something
I was going to say,
Keith, get them in trouble.
We don't want to spread the virus.
No, I'm not going to do that.
Listen, we got about 3 minutes left, but I'm going to try to get this one call in. Mary Alice joins us from Franklin. Hi, Mary Alice. You're on the air.
Hey, Barbara.
Hi, how are you?
I'm wonderful. How are you?
Good, I'm okay. We only have a few minutes, so go ahead and ask your question.
Well, twofold, real quick. I just got my flu vaccine.
Yay.
I want to get my COVID booster, the new COVID booster, before Thanksgiving, in time for that to kick in. Do I have enough time frame in there?
Yeah.
Oh, yeah. Most definitely. Okay. You could actually do it even now. You can get them at the same time. I just not been a big fan of that. I tell people 1 to 2 weeks in between, and you're good.
Okay. All right. Second thing, real quick, just a reminder to remind us older folks that if they have not gotten their shingles vaccine, they need to get it. They need to get it.
Yes,
okay.
100% agree. 100% agree with you.
I had a friend that had a terrible experience with it. They got shingles. It went into their spine and migrated to their brain, and they had meningitis.
Oh, wow.
Yeah. And so I agree 100%.
Thanks, Mary Alice. Mm-hmm.
Everybody get your shingles shot. Do not mess around with that. Nobody wants to get that. So, because it can be mild, but it could be extremely severe as well, and you never know who that's going to happen to. So, get it.
So, one last question, since I turned 65 this year, I got the super. I call it the super dosage of the super flu shot. What's the difference between the two?
Just the amount.
It's the amount
you get. It's just the amount you get. That's all. It's just because they want to really boost you up. On that immune. So it's a lower dose for most people than for at a certain age range. And you know how diplomatic I said that. At certain age range, you get the higher dose, which would give you just more of a boost of your immune system. That's all.
Okay. So the bottom line is tell people 3 things think about and do to protect yourself this year from all these respiratory infections that are out there.
Wash your hands, wash your hands, wash your hands. Make sure you cover up, and get your vaccines. Symptomatic treatment, for you, and stay home if you have something major. Don't be getting out there giving it to everybody. Don't be like me.
All right, Keith, tell us one more time about your vaccine clinic that's coming up.
Okay, so it's going to be November 5th at the historic First Baptist Butte Street, right across from Scope. Is going to be in the Murray Center, Robert Murray Center, and it's going to be from 8 a.m. to 12 noon. And you can come. Now, the only thing I have to ask is whether we're giving flu shots. I don't know yet, but I'll give it to you before next week if you can make an announcement. But I know we're definitely COVID boosters we're doing for sure.
Okay, and do you need to register or anything, or can you just show up?
You just show up. We're trying to get people registered, but if you show up, we're gonna have it. We can hook you up.
Okay, that sounds good. Thank you so very much. That's cardiologist and co-host of Another View on Health, Dr. Keith Newby, and we'll be right back.
Hello, this is Spike Lee. What's happening? And you listen to Another View.
And welcome back. It's titled Nothing Special, but the story behind Desiree Cooper's new children's book is very special. In her book, Cooper, a Pulitzer Prize-nominated journalist, chronicles the relationship between her grandson Jax and his great-grandfather. But this former attorney and community activist goes further than that. As our Lisa Godley discovered, Cooper also glances at history by reminding us of how the Great Migration separated millions of Black families and how some have made it a point to reconnect with loved ones who chose to remain in the South.
Good morning, Jax. His grandfather woke him with a kiss. Good morning, Pop Pop, Jack said, leaping out of his bed. What are we going to do today? I think we'll do some of the things that I did as a boy, Pop Pop said. Like what? Jack asked. Pop Pop smiled and said, nothing special.
Desiree Cooper calls her first children's book an intergenerational buddy story between a boy and his great-grandfather. 6-year-old Jax endures a long car ride from his home in Detroit to spend a glorious week with his grandparents in coastal Virginia. Back home, fun was playing with his toys and going to the movies. But Jax soon discovers that the things Pop Pop considers nothing special, like counting fireflies, shucking corn, and crabbing, are nothing short of an adventure. But there's a deeper historical connection, one Desiree Cooper calls reverse Great Migration.
Our families have been torn apart over and over in our history in the United States. First through the slave trade, then through slavery itself. Reconstruction, there was a big scattering of our families. And then the Great Migration was one that we had a little bit more agency with. We had a choice, but the choice was to stay alive by leaving. And so we have to really understand why these things take on so much more meaning for us than it might be for other populations of Americans.
Jax and his grandpa's adventures come to life through amazing illustrations created by fabrication artist Beck Sloan.
She literally handmade everything that's in the book. So the characters look, just for lack of a better word, kind of like puppets, and they are in settings that are clearly made of different kinds of textiles. The characters all have a metal ligature like a skeleton so that they are posable in all kinds of directions, not just at the joints. And every detail is done by this artist and then photographed. So when you see water, when you see sky, when you see stars, these are all fashioned by the artist.
So how does a Pulitzer Prize-nominated journalist end up writing a children's book?
Journalism in general taught me how to write tightly and short. And I think that for someone that may have been coming out of writing a longer form, it might have been a lot harder to transition to a children's book. But I was used to writing a column. It's around 700, 750 words. I start to wind down, and I find myself doing this all the time, even in my creative work, because that's how my brain was trained. And that's about the length of a children's picture book. So my biggest chore in doing the picture book wasn't the length, but just choosing the scenes and, of course, making sure my language was lyrical enough to be read out loud to children. It was kind of a nice fit. It wasn't that difficult of a transition.
Nothing Special isn't even 2 months old, and Desiree Cooper is already receiving accolades for the book, with a starred review on Booklist. And she's pretty sure this won't be her last.
Can we go to the movies now? He asked when they got home. Instead of answering, Pop Pop went into the house and came out with a newspaper, 2 sticks, tape, and old string. What are you doing? Jack asked. Pop Pop tied the sticks into a cross. Help me tape the newspaper to the sticks, he said. When they finished, Pop Pop held it up. It's a kite, Jax exclaimed. At the park, Jax ran while the kite danced in the sky. He thought their kite wouldn't fly as high as the other kite that came from the store. But it did!
For Another View, I'm Lisa Godley.
And Desiree Cooper was a 2015 Kresge Artist Fellow specializing in literary arts. And you can find her book wherever you get your books. So wash your hands, wear a mask, get your COVID booster, and get your flu shot. All ways to protect yourself during this cold, flu, RSV, and COVID season. Be sure to share this show with someone that you love. Go to anotherviewradio.org and download the podcast. And we're making progress with increasing the numbers of you who receive our eView newsletter, a once-a-week reminder of upcoming shows. So while you're on our site, be sure to sign up. Our theme music is an original composition created especially for Another View by Jay Sennett. Lisa Godley is our show producer. Christy Jordan is our audio engineer. And Dr. Barry Graham answered our phones. And I think it's Jordan Christie. There we go. I'm Barbara Ham-Lee. Thanks so much for listening. And let's get together again next Thursday at noon for Another View.
Support comes from Hampton Roads Community Foundation, carrying out your charitable wishes forever, whether it's helping shelter animals, feeding the homeless, enhancing the arts, or supporting students. Learn more at leaveabequest.org.